Let's start, orang.
Okay,
Assalamualaikum warahmatullahi wabarakatuh and very good afternoon. So we will welcome all of you to Professor Talk RMC UNIMAP sharing program today. Before we start, let us recite Umul Kitab Al-Fatihah. Okay, I have a few announcements here to all participants. Kindly fill in the registration form as I put in checkbox there. Certificate of participations will be provided to all registered participants after this webinar. And lastly, during presentation, please turn off your microphone. Okay. So before we start, let me brief about you about our speaker today. Today we have a Professor T.S. Dr. Uda bin Hashim. He received bachelor's honors degree in physical and applied physics from University Kebangsaan Malaysia UKM in 1987. Upon graduation, he joined Dewan Bahasa dan Pustaka for 2 years until 1988 as pegawai perancang bahasa and then joined MIMOS Semiconductor Sdn Berhad. He served MIMOS Berhad for 40 years and gained vast experience, especially in the CMOS wafer fabrication foundry. While working with MIMOS Berhad, he has been sending to several organizations abroad for technology acquisitions, includes NMRC Republic of Ireland, Azari USA, Fraunhofer Institute Germany, Nikon Japan, and Republic of Kyrgyzstan. Okay. In 1998, he continued his PhD degree at UKM in microelectronic engineering and graduated in 2001. He was then in 2002 joined University of Malaysia Perlis as a lecturer in the School of Microelectronic Engineering. In 2004, he has been appointed and entrusted to be the first Dean of UNIMAP Research and Management Unit. 4 years later, he has been promoted to Professorship PK7 in Microelectronic Engineering by University of Malaysia Perlis. During this period, he managed to cultivate research culture among the university academicians and has successfully developed a conducive research environment for the university. In 2012, he has been again promoted to Senior Professor VK6 in Nanoelectronic Engineering. Based on his outstanding achievement in research, he has been requested by the Ministry of Higher Education, Deputy, to establish the first research institute in UNIMAP in the field of nanoelectronic engineering, namely Institute of Nanoelectronic Engineering INEE, and serve as the first director until April 2017. Based on his vast experience in research, in April 15, 2017, he has been appointed by the Ministry of Higher Education as Deputy Vice Chancellor Research and Innovation UNIMAP. So he has secured various research grants value more than 8.8 million as the principal researcher from many sources such as IRPA, FRGS, PRGS, LRGS, PPRN, and Science Fund. Recently, he obtained a matching grant from CREST worth 562,000 for medical diagnostics project. So in 2019, Professor Dr. Uda Hashim has been awarded as Malaysia Research Star Award by Clarivate USA and Ministry of Education Malaysia and Top Research Scientist Malaysia, TRSM by Academy of Science Malaysia in 2014. He is one of the recipients of ISESCO laureate in 2012. He also obtained National Patent Award in 2013 from Perbadanan Harta Intelek Malaysia, MIPO. So without further delay, I would like to call upon our Professor T.S. Dr. Uda Hashim to deliver his speech entitled Potential Innovation to Fight COVID-19 Pandemic Preliminary Evaluation. Please welcome, Prof.
Okay. Thank you, Dr. Rashidi, for nice introduction about myself. Assalamualaikum warahmatullahi ta'ala wabarakatuh and very good afternoon. First of all, I would like to thank UNIMAP RMC office for inviting me to this special session to me. It's a scientific talk. It is my privilege to be a speaker for this platform. So I'm going to deliver or to give a speech on something very, very important. Something the word that I'm going to use is very popular. I think the most popular in the world right now is very scary. So everybody throughout the world, people living in the city, living in the village, jungle, even though in the jungle, they are scary about this word. It's a COVID-19. So almost everybody in the whole world. Okay, aware or not about what is a COVID-19. We don't need to explain to them. So almost every day, every time you are talking about COVID-19, COVID-19 is very, very scary. It's a very, very important to us for our own survival. Okay. So the title of my presentation is Potential Innovation to Fight COVID-19 Pandemic. So we have to be together to fight COVID-19 pandemic. So what I'm going to present basically is about the preliminary evaluation of my innovation for current and also for future application. So this is the keyword. I think the most of the word in my speech will be using this word, biosensor. What is biosensor? Is comprising of two components, bioreceptor and transducer. Okay, and then analyte. We are talking about COVID-19 virus, coronavirus, and the electronic reader, whereby I develop in-house to read the reaction, the biological reaction, and then converted into electrical signal. For the processes involved, so we are talking about complementary, non-complementary, and mismatch, and then functionalization. Okay, want to be specific on detection. Okay, what we are going to study, and then we talk about rapid. So the gadget that we are going to develop, that I'm developed, must be rapid. So this is the demand, labor-free. So we need to prepare the sample for any diagnosis, and then must be in quantitative instead of qualitative, sensitive, selective, and accuracy. So this is the keyword of my presentation. So COVID-19, as I mentioned earlier, is something very popular right now. It's very scary. So we know virus is very small, but the impact is big. Small, but the impact is giant. Okay, we can't see this virus, but the impact to us are very scary. Okay, so everybody are aware. Everybody are almost about the virus. So what if you want to fight with this virus, what do we want? So there are two things that we need urgently to be in place in the country. Okay, one is the diagnostic kit. The kit must be rapid and accuracy must be high as close to 100%. So the other one is virus. Each and every country in the world, so they are competing each other to produce the first vaccine, okay, to fight against coronavirus. Vaccine and rapid diagnostic kit. Okay, what we want is a rapid, as fast as possible. Okay, the faster the better. Should be less than 1 hour. Should be less than half an hour. Okay, within a minute, within a second, we can detect the viruses. So this is the demand all over the world. So in my research, basically, I conducted the motivation why I conducted this kind of research is to help the doctors, so that the doctors, they can diagnose the patient and then get the result fast, so that they can act immediately to the patient, and also to help the biotech so that they can design the drug specifically to the specific disease, to make people happy and healthy. So this is my motivation. I'm currently conducting this kind of research. Even though my background is not a biotech, even though my background is not medical, but my background basically is electronics, but my interest in medical. So with respect to diagnostics, so since I'm talking about diagnostics, the previous or the current scenario, basically everything are lab-based. We collect the sample and brought the sample to the lab. Okay, and then in the lab they will do the analysis until the result comes up, and then we require expertise to interpret the result. Certainly, we need an expert to interpret the result, because everything are in qualitative form. So everything in spectrophotometry form. Okay. Manual, human error, time-consuming, label-free, single detection, high volume, expensive. Okay, bulk instrument, less sensitive and not specific. So this is the current scenario about the diagnostic. So what the world demand based on the current scenario, we need a rapid, must be label-free, meaning that the sample that we collected, we don't need to process. We just take and then we extract and then we use for diagnostic or detection. Must be very selective, must be very sensitive. Okay, and then better to be handheld so that we can bring the gadget, the tool, the system everywhere we like. Must be automatic data interpretation in situ. We can do it in situ, so we don't need to bring the sample, collected sample to the lab, but we can do bring the gadget, the system to the site, and then we conducted everything at site. Okay, low volume multiplex, so we can conduct analysis simultaneously. So no need to do it one by one. Everything is a multiplex. Simple processing, affordable, low cost, and low energy. So this is the demand. Okay. So with respect to this diagnostic system, so this is the problem, and then this is the thing that we have to solve about the sensitivity, okay, about the selectivity, about the rapid issues. Must be rapid. So the diagnostic, the analysis must be rapid. About the qualitative, okay. Instead of qualitative, we have to move to quantitative, and then the system must be multiplex. We can do semesterly the analysis or diagnosis, and then must be portable. So all these these issues, problem, we have to have the solution. And then if you look to this, because research, the job of research is to solve the problem, to provide the solution. For example, for the diabetes patient, normally they are very scared, phobia. So with the needle, with the blood, how to solve this problem? So we have to have some idea, solution to solve this problem. Okay. So my strategy basically in this particular research, so for the sample, I start with the blood and moving on to the urine, saliva, and sweat. So what do we need to improve? Basically, we need to improve the device, the system, the gadget. So the sensitivity of the device must be improved accordingly. Okay. Certainly in the urine, the substance that you want to detect become lesser. Of course, they become much more lesser in the saliva, and then very difficult to detect in the sweat. So that's why we have to develop a device which are very, very, very sensitive, so that they can detect it at this particular level. Okay, that's why we need nanotechnology. So nanotechnology can help to solve this problem. So this is my strategy. Basically, what I'm trying to show you is about the background of how I reach until this level. Before I show you the finding about the COVID-19, I want to show you how long I took to draft my research until I reached this level. So in the diagnostic system, so there are three components that we have to solve in parallel. One is about the sample. Second is about the kit. We have to decide what type of kit that you want to use. And then the last one is the reader. Okay. So the sample, for example, at the moment, everything are lab-based. Okay, label-based. Everything are done in the lab. Okay, we have to prepare the sample. It's very time-consuming. Okay, preparing the sample in the lab and took too much time. And then also too many consumable involved, equipment involved. We need a huge lab, so everything are very expensive. And then now we have a kit. Okay, certain scientists they already developed the kit. We reduce a lot of things. Now we use a kit. But if we can move our sample preparation to lab on chip, so this is the ultimate goal actually, lab on chip. So I'm moving into this direction, whereby for the kit, so most of the people basically in the chemistry lab, they are using antibody binding, aptamer binding, but in my situation, I'm using DNA binding. And then for the reader, from bulky equipment in the lab, moving, do some modification, make it as a portable, and then finally moving to the handheld system. So this is example of the DNA acceleration on chip. Okay, I'm currently working on the DNA acceleration on chip for the DNA. Okay, I would like to extract DNA on chip. Okay, the device is very small. I just drop at one point, and then another point I will add. I will get the DNA extraction. So if you compare apple to apple between conventional by using kit and the lab on chip, we can see the flow for the kit, they are very complicated. Okay, long step until we got this single-stranded DNA. But if using the lab on chip microfluidic system, so we just have the device, and then we drop the sample, and then toward the end we already got the accelerated DNA. Okay, so this is what we want to develop in the near future. So basically, this is my solution for the COVID-19. Okay, so I solved two things here. One is about the time, it's very rapid, and then about the accuracy. Okay, if you look to this, they're comprising of three systems. So my device also have the IoT capability. So the data that we capture, we can transfer to the smartphone live. Okay, so comprising of three components: sensor, and then interface, the sensor platform, and then the reader. Okay, so the sensor we are using IDE based, and then we functionalize, and then we also can use the lab on chip, the microfluidic, to deliver the sample to the point of care. So this is the solution that I provide for COVID-19. I will show you all the data that already developed. This is one example of a lab on chip. So we drop at one point, and then we go to one point, and then we'll go immediately to three point of care for the measurement. So this is what I mean by simultaneously measurement. So the value proposition of my device, so I put it here, is handheld and quantitative. So my reader basically already, so they can I convert the biological reaction. So the reaction is in biology into the electrical signal. So my device will capture all this electrical signal, and then come up with the data in the digit. Okay, instead of qualitative, everything are in quantitative. So we no need to interpret the data. So the system will interpret the result for the user. Okay, so I put it here. Okay, processing time faster than conventional. Detection limit 1 femtomolar, 1 micromolar. Measurement method are very simple. Okay, process flow, and then one of the important aspect here is no need to interpret. Result interpretation, whereby my reader, where the conventional one happen in the lab, they have to interpret. Okay, because everything are in a qualitative form, spectral. So this is biosensor, as I mentioned earlier, comprising of two components, bioreceptor and transducer. Okay, and then the bioreceptor must have two components here, probe and linker. Combination of both transducer and bioreceptor, they become a complete biosensor for any specific detection. It depends on the probe that we are using. For this situation, for the COVID-19, I'm using this probe, okay, for my detection. So this is the sequence. And then for the detection strategy, there are three different types. We can choose which one we like to use. But in my situation, my device, I'm using the DNA-based detection. Okay, I'm not using antibody antigen and also aptamer-based detection, but I'm using DNA-based detection. So the target that I'm using is the DNA. For the convict is a RNA. Okay. Convicts they produce composed by RNA. Okay. So that's why they have to use RT PCR to amplify the signal, to amplify the RNA. Reverse transcription. So they have to convert from RNA to DNA because our PCR they already processed the DNA. Okay. So same thing to the probe design. We can choose either want to use a dilated or want to use a mine or carboxylic. So which one is the best suitable to your design? So we can use. You can choose from these three different probe. Whereby transducer, there are several types of transducer available in our lab, in the Institute Nano. So we can use a solution-based FET as a transducer. We can use extension gate FET as a transducer. We can use a IDE-based. We can use a thin film nanorod, okay, for the extension of IDE. And then we can use a nanowire, and also we can use a nanogap. And then we introduce certain nanomaterial in between, just to improve the sensitivity. So this also depends on how familiar you are with the device, with the transducer. Okay. So this one is about the RNA or DNA, the principle of the RNA basically. So there are three terms here: complementary, mismatch, and non-complement. So the pair will be matched with their own combination, adenine and uracil, cytosine and guanine. Okay. So if each and every pair they match, so meaning that this is complementary RNA. Mismatch means some of them are matched and the other some are not matched. Not complement meaning that all of them are not matched. So if they are coming from, let's say now we are using a probe RNA and then we drop a sample, the sample contain COVID-19 and then the probe also COVID-19, they will have a full complement. Okay, if they are coming from the different species, for example, the super spreader, they are also COVID-19, but after the mutation, so they have some changes in the sequence. So some of them will be match, complement, some are not complement. They are considered mismatch. Non-complement, all of them. So they are not coming from this species. So they are not complement. So this is the principle of the RNA and the interaction. Okay. And then from this combination, they can introduce some electrical properties. If they are complement, so they will introduce electronic clock. More electronic clock will be introduced as compared to mismatch. And then non-complement, the electrical is almost zero. So from here, we can capture and then we can turn into electrical signal. Okay. So this will tell the difference between complement, non-complement, and mismatch. So we have a probe-target interaction, we have a transducer, and then we introduce a linker, and then we drop the probe, and then finally we probe the target sample. So sample which are matched or from the same species, so they will complement. So and then sample will not match, they won't complement. So based on this complementary, they will introduce the electronic properties. Okay? Electrical properties that we can capture and measure. This is how the functionalization step. Okay, the step how to functionalize the device, how to introduce the probe on the transducer. It's very simple. If you look to this cross section, okay, we just drop and wash, drop and wash. Then the device is functionalized. So the device will stand on the electrode, on the conductor electrode. Okay. So this is the IDE, bare IDE, functionalized IDE. So this I'm going to show you some electrical result. So after each and every step, I will do electrical measurement. I want to see. So what is the electrical different between steps. So first I measure the bare IDE. So in this development, what I want to understand is when we have two electrode, okay, 2 point. So I want to know what is the minimum current required to make the electron jump from one point to another point. Okay, what is the minimum? Why we want to have the minimum current? We want to understand the minimum current because we want to safeguard the DNA or RNA. If we give a too high current, slightly higher, so this RNA DNA will burn. So we need to have a very small current so that the DNA they still can survive for the next processing. Okay, so I want to that's why for this development, the smaller the better in terms of the sensitivity. That's why you have to produce the structure as close as possible to the nano dimension. Okay, nano to the nano structure. So and then we measure the uptest. So we can see here they give a different value, and then after we probe we drop the probe. Okay, so they will give very significant difference. So we can see the difference between them. Okay, so this is the electrical property that I capture from the reaction, biological reaction. So this is the electrical electron reader. Okay, so comprising of several component amplifier. Okay, and then finally turn up into a complete system. What important here must be a low noise reader. Everything must be low noise so that they can handle a small current. So this system can handle a current ranging from femto so until milliamp. Okay. So based on my development stages, so everything I started with a lab base. The system is very bulky, so I conducted in the lab, and then I improved the system to make it portable so that I can move from one side to another side, from one lab to another lab. So this is very important. Some of the sample they are very secrecy, very privacy. So I have to conducted my experiment in their side. So finally, my intention is to produce the handheld based on the demand available for the market. If we look to this, the development route, so I started with a small invention and then move on to make it better. Number 2, number 3, and finally this is number 4. The final one, much better, look like a ready prototype. So for the management protocol, let's say we already have the reader, it's ready to be used. Okay. So the first thing that we have to do, we have to functionalize the sensor. It took almost, I think, 2 hours to develop the sensor from scratch, from zero, until we got the functionalized sensor. So after this one is ready, okay, and then we got the sample from swab. We can use a sample from saliva, swab from the throat, or we can use a blood. And then first thing we have to do, we have to extract the sample using whatever kit available. And then I took this extracted sample, then drop on my device, okay, and then wait for a few minutes. Then I press the button, so the system will calculate and then show the result. Okay, as simple as that. The step is almost like this. For this COVID-19, raw sample and then extract the DNA. For this situation, I don't want to handle a raw sample. It's very dangerous. Okay, it's very dangerous. But I only started my experiment from the extracted RNA. It's less dangerous. Okay, it's less dangerous. Everything is already cut, so it's not active. So we can use from here. Let the clinical lab, they handle on the raw sample. So they translate from raw sample to the extracted RNA. I just took this one, and then moved to the PCR. So we are moving to the same different direction. So after extracted RNA in the clinical lab, they will go to the PCR, RT-PCR. But for me, I just took this one and then go to my device. I just drop, okay, and then I measure, and then the result comes out. Okay, it's very, very simple, very fast. So from here, I require the most is 1 hour, okay, to get the result. Whereby if they go through the PCR, not less than 8 hours to secure the result. Because of the handling now for the positive, the fastest they can come up with the result is one day, and no, for the negative 1 day, and then positive 3 days. They have to repeat again. They have to send to the IMR just to confirm that the sample is really positive. Okay. This about the selectivity. Okay, same result as I showed earlier. And then after, okay, so the left graph, it just the result stop at the probe. So meaning that this sensor is ready to be used for testing, for detection. So after the probe is immobilized on the sensor, on the transducer, so I start to drop the sample. So at the moment, for my validation process, I'm using the synthetic sample. I'm using synthetic. So synthetic meaning that the sample, the target sample, they are very clean. So in this tube, they only contain that particular RNA only. They don't have any other as a contaminant. So that's why the result is very perfect. Okay, we can see after I drop complementary the target sample, so they will complement. So after they complement, they will give us a significance. We can see the different result. If there are not complement, I drop the sample whereby I don't have any target sample, the result will be almost similar to the probe because nothing is happening electrically. So they doesn't introduce any electrical properties. So in the measurement, electrical measurement, they don't have any result. They're almost like a probe. Okay, as I mentioned just now, complement, non-complement is mismatch. In here, it doesn't show the mismatch. If we drop the mismatch sample, they will fall between complement and non-complement, between complement and probe. So for the mismatch, the electronic, the cloud they introduced is small as compared to complement, fully complement. So of course, the electrical properties are larger. Okay. So this on the right table is the result based on many times. So this is the result I obtained. Okay. So this result is very important for my cutoff measurement decision or for my to be included in my system, okay, as a software. So this one just to check the sensitivity. So how sensitive I stop at 1 nanometer. I just to see how sensitive is my device. At what level they cannot observe or they cannot detect the presence of the RNA. So this one I just stop at 1 nanometer. So we still can capture and measure. Okay. Actually, in my device, we can go down to 0.8 femtomolar. 1 femtomolar, according to the expert, is equivalent to 1 DNA, single DNA. So this is so-called single molecule detection. Okay, single molecule detection. So now we can go until single molecule detection, meaning that even single DNA also we can detect theoretically. Okay. Okay, now we come to the validation. So as I mentioned earlier, in the first stage, I have to validate my reader with the Kitli. So Kitli is a gold standard system. I have to compare electrically the result, the reading. So they give almost similar reading. There's no problem, no issue. And also I compare with the smartphone, also give the same value. After this one is completed, I followed by the measurement, by the sensor measurement. Okay, so I start with the synthetic to make sure when I use a complement sample, so they will give a complement result. When I use non-complement sample, so the result is non-complement. Mismatch the result. I repeated many times. So they just to make sure they are repeatable. So they give there is no false positive, false negative. So I also success on this this level. And then what I did next is I take the good real sample. It's a good sample, meaning that in this sample, it's not contain any specific disease. I just drop my device, they will give all negative, meaning that the device is good. The operation of the system is good. And then what I did is, the next stage is using a good real sample, okay, and then plus induce the sample with a positive sample. Okay, so I take a field sample, a real sample, and then I induce. Also, they give a positive sample. Then the next stage, now I come to the non-clinical sample. So what I mean by non-clinical sample, so the sample is already tested and then already have the result. So I took back all the sample and test on my device. Does the device give the same result or not? And then only the final, the real clinical trial, we will do a apple-to-apple comparison. So between clinical sample, between this gold standard, clinical gold standard, with the device that we develop, then we compare. So these are real clinical sample has to be conducted. So the result below just show. So my clinical trial recently. So almost the result identical or perfect according to the gold standard. So the Kari Nescafe, this is considered good sample. So the result obtained here from the Kitli. Okay, Kitli produced the graph, and also the reader that I developed, they just mention yes or no, because I already include the as algorithm to be the cut-off value, to be yes or no. Anything above this one, it says, below is no. So this one is based on my optimization process. I got the value and then include in the system. So everything are identical, almost similar. Okay. This is for the no result. Okay, it's a no. So you see the result for the Kitli, they are below probe. Okay. So this one is a comparison result between Kitli and reader. So if you look to the table, the results are almost similar, very close. 8.9 nanometer for the Kitli, and the reader also 8.9, 8.2, 8.4. So we repeat many times. So this I compare between these two. The left picture is using Kitli, and then the right picture is using my reader, developed reader. And then this one, okay, this one to compare the electrical measurement, and then this one to compare on the sample. It's a synthetic sample. Also, they give the same result. This for the no result, and no result. So they fall within a probe value. Okay, they fall within a probe value. So meaning that there is no. So this for the complement and non-complement. This one is for the non-complement, and then this one is for the complement. Okay, so we can see the difference. So the graph I took from the Kitli. Okay, and then at the same time, the reader also read the result, yes or no. So yes, here mean the system give the result yes. Okay, same thing to the Kitli. Okay, yes. These are for the yes result, because we use the complement target sample. Okay, this one I just dropped different viruses on my COVID-19 probe. So of course, if I use this, you go to the graph. If I use the green line, it is a complementary COVID. So of course, they will give some significant difference from the probe, which is red. And then if I drop salmonella, of course, there is no significant difference there. The value will be less than or equivalent to probe. Okay, they will give the result no, no, no. So the system will tell no, okay, and the Kitli also will give the result no. Yes mean the red line must be above the black line, and then for the no must be below the black dot line. Okay. And then this one is using a real clinical sample. I conducted this experiment in the clinical lab. Okay, so I conducted this experiment under the supervision. Okay, the medical team and the biotechnologist team. So this is the first trial. So the first trial, for this trial, so I didn't use a blocking agent. I use an ordinary process flow equivalent to the synthetic sample. So the accuracy is about 80%. From how many? From 10 of them, 2 are not. The result are false negative. Okay, false positive. Good. So actually, the PCR result is all negative. Okay, because of this blocking agent issues. So I didn't get a real, but still high, 80% for the accuracy, okay, as compared to existing in the market in the lab are less than this. But the government, the KKM, they require must be minimum 85% and above. But I repeat again, using a blocking agent. So finally, I got 100% accuracy. The positive, I got positive. The negative, I got negative. Okay. So I got 100% accuracy. So this is my first trial. So I will continue with more clinical trial just to get more data. Inshallah, in the days coming, in the months coming. So I will conduct more clinical trial so that to prove that the device that I developed in ours is work, okay, for detection of this COVID-19. Okay. So with that, so this is the conclusion of my presentation. Basically, what I'm trying to highlight about my current achievement about this innovation for COVID-19 detection. So it's very convincing to me. I'm very confident that the system is work theoretically and practically. So the device is ready, okay, to be utilized. So I would like to take this one to help the country as well as neighboring country who are interested on this one. Maybe I can work. Okay, I can work. So within 1 hour, so we can do a multiple measurement. Not only can have a 3, 4, but we can have 10. It depends on the interface that I have. If I have more, so we can measure more. So this is the only thing that I need in my near future, okay, to continue my clinical trial. So with that, I end my presentation. Thank you for each and everyone in this forum listening to my presentation. Thank you for your support.
Okay, thank you, Prof. Dr. Uda. Okay, for your very impressive presentations regarding to now we are facing with a crucial pandemic, COVID-19 pandemics. So, any question to the speaker? Open question to the floors. If any question for Prof. Uda.
You can ask any question.
So please ask Prof for any question.
You can ask now or you can email to me. There's no issue. I will answer all your questions. Even I can demonstrate the system to all of you. The only thing that you have to have is a sample. If you can provide me a sample, I can demonstrate to all of you.
I think it seems no question, Prof.
Very scared, huh? About COVID-19.
So they have email, Prof. Uda there. They have email and phone numbers. If any regarding on nanotechnology, can directly email or call Prof directly, yeah, Prof.
Yep.
So I think that's all from our webinar today. Really hope that we gain a new knowledge. Till then, I thank you for your time and participations. So for those who still not fill in the form, please do so, because this is related to your online certificates, and we will send the recorded video to your emails. And so we will continue our Professor Talk RMC UNIMAP sharing program series on 25th of September. That one by Professor Dr. Muhammad Rizal Ashad, Deputy Vice Chancellor Academic Internationals. So I think that's all for today's webinar. And if we would like to request all participants to turn on your webcam. We want to screenshot your screen. Okay, Bro?
Okay, thank you very much.
Okay, please turn on your webcam. Looks there, Dr. Aiman. Aiman, Dr. Faris. Okay, so I will screenshot. 1, 2, 3. Okay. Okay, I think that's all. Thank you. Assalamualaikum warahmatullahi wabarakatuh.